about 16 years ago, I learned a different treatment approach that sort of turned my world upside down. It literally was 180 degrees opposite of what I learned in school and what I learned from all the back gurus when I would go to a continuing education course. And it was looking at the body as a whole and finding the imbalances throughout the body that are caused by the way your body compensates for pain.
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and today I am speaking with Dean. We're doing a little bit of a departure today and talking about back pain. And as you guys know, I'm into talking about topics that have a lot of misconceptions and debunking them. And so this is one of my near and dear topics because I personally have suffered from pretty terrible back pain. And just last night, my partner had brand new zowie, zingy, painful back pain that, fits right into our topic today. So if I ask you any specific questions about that, it's completely for personal benefit. But anyway, so Dean, thank you so much for being on the podcast today.
Thank you so much for having me, and I look forward to talking and getting some information, hopefully out to your partner.
Yeah, and to everybody else. Yes. Yeah, so it's it hits everybody. So I really think there's so much in this topic that people will be interested in. So that's why I'm excited to talk to you today. So Dean has been a physical therapist for over 30 years now. He's got his master's of physical therapy at Northern Arizona University. And he has been I did look you up. So we are exactly the same age. We graduated from college at the same moment. So I won't say that we're both old, but we're a little slightly.
We are well treaded.
So he started his business in 2018, really focusing on trying to fix everybody's sciatica because it's been just sort of not really well treated by traditional means. But before that, he was in physical therapy for 30 years, started his business in Charleston, but more recently moved across the country to Santa Monica, California. So welcome to the Pacific Coast.
Thank you very much. It's beautiful here.
So can you tell your story, how you went down this path and how you ended up doing your sciatica consulting?
Sure. Well, I graduated, Dr. D said, in 19 from physical therapy school in Northern Arizona University, and immediately got involved in directing clinics. Actually, a year after I graduated, the company I was with said they wanted to start a clinic in the area where I lived in Scottsdale, Arizona at the time, and they asked me if I wanted to oversee it. And I said, absolutely. So they literally just said, hey, find a location. So I found a location. They said, tell us how you want to build it because we want this to be yours. So by my second year, I was overseeing clinics. And as life would have it, things did not work out with this clinic after 10 years. And I was supposed to purchase it, but wound up moving to the East Coast to be near family in North Carolina. And I started my own practice in 2000. I told my brother, by the time I'm 40, I want my own clinic. And a month after I turned, or 2 months before I turned 40, started my clinic, built up to 3 clinics in the Charlotte, North Carolina area. COVID hit, and I looked at that as an opportunity to say, hey, you know what? Let's get out of here. Let's leave. I mean, my businesses had the normal ups and downs, and we were able to sell the clinic in November of 2020. And at the time, I was sort of living in and working in Charlotte, North Carolina, while my wife and 2 boys were in Charleston, South Carolina. So I was bisitual because I was going to the city, going to Charleston during the weekends, working in Charlotte during the week. So it was awesome to sell the clinics. Lived with my wife and 2 boys in Charleston, South Carolina, where they went to college. And in May of 2021, we moved to Santa Monica. But what happened during that time, about 16 years ago, I learned a different treatment approach that sort of turned my world upside down. It literally was 180 degrees opposite of what I learned in school and what I learned from all the back gurus when I would go to a continuing education course. And it was looking at the body as a whole and finding the imbalances throughout the body that are caused by the way your body compensates for pain. And one of my struggles during my practice years was helping people with sciatica to get long-term relief. I was great at getting them some short-term relief, but their symptoms would always seem to come back. And I literally was helping 25 to 30% of my clients who thought that I was amazing. But the 70 to 75% of clients did not think I was very amazing because their symptoms kept coming back. But after taking this course about 15 years ago, the 25 to 30% success rate went to about 75 to 80% overnight by just balancing out the body's imbalances. So I was walking to my clinic one day and I just started looking up online on Google what to do for sciatica because I wanted to see what everybody was doing, what the internet was saying, what YouTube was doing, what Google was doing. And it was all the old treatment approach that I used to use. And I knew that was not very effective. So at the time, 6 years ago, I was 51, 52 years old, and I decided I want to start a Facebook group just to see what kind of feedback I can get. And I had no idea what I was getting into. And being over 50, I had to look up on YouTube, how do you start a Facebook group? Because I didn't know how. I started my Facebook group on a whim, invited 2 friends and my wife. And I had no idea that it was going to explode to the point of where I could run a full-time business off of just helping people online. And it wasn't meant to be that way. It was just I was trying to help people. And I would do free webinars on the weekends. I would start seeing people just for some free consultations to see if I can help people. I was getting people from Australia, from Canada, all over the US, from Mexico, and a lot in the UK. And it started to almost become more of a full-time job than my full-time job was. And I realized, hey, you know what? At the time I can sell my clinic, when I can sell my clinics, I can actually just slip right into this because it turned out to be so busy that it was taking up so much time that I realized, okay, I can start doing online sciatica relief. And that's what I've been doing for the past 6 years with the last 3 years full-time.
So I can totally understand back pain that is not being really addressed well in traditional medicine and nothing's really working. People are quite desperate to find anybody who can help. And if you find something, you really hang on to it because it's so difficult to live with back pain. So I'm curious to know, for our audience, can you define what is sciatica and is that the same as just back pain? And then we can kind of go from there.
Great question. I always tell my clients, and what I like to tell people is sciatica is sort of a catch-all generic term. To me, it's really not a diagnosis. All sciatica means to me, and what it typically means to anybody in the medical field, is that your sciatic nerve, somewhere along the line, whether it be at the nerve root or along the main part of the nerve, something is being irritated and aggravated. And I tell people you can have pain anywhere from your low back to the tips of your toes. It can be anything that you can dream of what a nerve pain would feel like. It can be sharp, it can be dull, it can be electrical-like shocks, it can be tingling, it can be numbness, it can be heaviness, and pain anywhere from your low back all the way down to the tips of your toes, anywhere in between, any spot along that whole line, multiple spots along that line. But to me, sciatica basically just means that your sciatic nerve is being irritated somewhere along the line. As compared to back pain, everybody knows what back pain is. You can get the stiffness, soreness, tightness, but you don't necessarily get the nerve-like sensations traveling down the leg or anywhere from the low back to the butt to the hamstring, the calf, all the way down into the toes.
Sure. So basically there's probably a big overlap there, right? And not all back pain is from irritation of the sciatic nerve, but irritating that nerve is so common. There's so many different things that can cause that.
Absolutely.
And so typically what's the workup for sciatica? What do people undergo for testing wise?
Typically what happens, they would go to their family doctor, or if it was bad, they go to the emergency room. And most of the time, the initial treatment is either pain medicine injection or you get some type of medicine prescribed. And it's either a combination of all of a muscle relaxer, an anti-inflammatory, and a pain medication. And typically doctors say, hey, you know what, if it doesn't go away in 2 weeks, come on back. And after 2 weeks or however long that doctor decides, you should try to work it out with the meds. If it doesn't work out and you come back, they often prescribe physical therapy, or they'll take an x-ray, which most of the time an x-ray is not going to show much unless there's something outlandishly crazy, which is very, very, very infrequent. So people will go through the medication and they would try some physical therapy. And if that didn't work, they go back to their doctor and then they get referred to a specialist, whether it be an orthopedic surgeon, a neurologist, or a neurosurgeon, who typically would order an MRI. And then they would decide, okay, is it actually coming from the back? Where is it coming from? And that's where a lot of confusion starts, because, all right, now we're trying different medications, maybe an injection, maybe an epidural injection, maybe a steroid injection. And it just, for most people, it becomes a complicated mess because they get an MRI, then they get told, you know, you have some degenerative disc disease. And people's brains go, oh no, I have degenerative disc disease. That's not going away. I'm going to be like this the rest of my life. And they just get bounced around, eventually winding up in a pain management if their symptoms are not taken care of. And the pain management doctors are great at giving more and different medications, maybe doing a radio frequency ablation or suggesting some type of epidural or other injections.
Yeah. And typically, they're not addressing the actual cause of the pain. They're trying to mask the pain, right?
Exactly.
So in my former life as a radiologist, I had a lot of experience looking at those x-rays and the MRIs. And for us, it was always quite baffling because, the x-ray is always the same. Like there's not going to be anything on the x-ray unless there is something super outlandish, right? So that's unusual. But people think that there's some answer on the x-ray. There's nothing on the x-ray. And then MRI, there's a big study that came out a long time ago, probably when I was in med school or a resident. The study showed that, so first of all, everyone gets degenerative disc disease. As you get older, the weight of gravity is smushing your spine and your discs bulge a little bit. And that happens to the vast majority of all human beings. And it just gets a little worse as you get older, right? So if you were to do an MRI on everyone our age, like take both your class and my class from college, the vast majority of everyone would have degenerative disc disease. And so the fact that you find that, of course, logical, but is probably not related to your pain because not everybody has back pain, right? And so
Correct.
Sometimes you can find a focal finding that will point to in a very specific spot. And that will make sense if someone who does a really good neuro exam, like a neurologist, has done a neurology exam and say, okay, the pain is pointing specifically to this location. And if you find an abnormality in that exact location on the MRI, okay, that's helpful. And then, okay, surgery might help. But otherwise, the MRI was just like not usually helpful. So it was, and it's very expensive, but that's what we tend to do in America.
Yeah. And I mean, I have the stats down with disc degeneration. People our age, 80 to 87% of people our age have degenerative disc disease with no symptoms. So if you were to take an MRI of me today when I don't have back pain, and then all of a sudden I develop sciatica 2, 3, 4 weeks down the line, the MRI is probably going to look the same, but now I have pain. Before I did not. So there's really no correlation most of the time with, the same with disc bulges. What I think it's 50% of 40-year-olds, 60% of 50-year-olds have disc bulges with no symptoms. So
Sure.
I get frustrated when people say, I've got to go get my MRI because I got to know what's hurting. And I go, well, let me just let you know, here's what they're probably going to find on the MRI. And they go, well, how do you know? I said, I'm just playing the odds and the statistics here because 88% of 60-year-olds have degenerative disc disease. That's just a fact. 70% of 60-year-olds have disc bulges. That's just the findings.
Yeah. And I think what people don't realize also when they're referred to a quote unquote spine doctor, usually it's a spine surgeon, is the surgeon's decision tree is binary. It's either surgery or no surgery. And the whole purpose is to see whether you're a surgical candidate. And they might use that MRI to decide that, but that's not necessarily going to help you. And in other countries, like if you go to the UK, they won't do that at all. That's not their path. They'll tell you to rest it for 6 months. And then there was another study that came out probably back in the 90s, that was showed that if you go to the UK and you get bed rest for 6 months, whereas you go to America and you get, a laminotomy, surgery may get you back to your normal routine a little bit sooner, but the end result is the same.
Absolutely. That's what I've been finding.
So, yeah, so tell me, so how does your approach differ and what do you do as a consultant?
So what I do that's different is instead of doing what I now call the generic exercises that all you need to do to find them is go on Google, type in generic sciatica exercises, and you'll see the press ups, you'll see the flexion exercises, the hamstring stretches, and you definitely got to work on your core because, hey, if your core is weak, you're going to have back pain, which has been refuted by every study that's ever been done. But we still think that way, that stronger is better. What I have learned is anytime your body has pain, the body's naturally going to compensate for itself. And I tell people, think of somebody walking around on a bad sprained ankle. Why is your head, neck, and shoulders bobbing and weaving when you're walking when the problem is down in the ankle? And it's real simple. Your body compensates. The area around the ankle is going to tighten up to try to protect the ankle. Plus you have pain, so you're going to be shifting to the good side so that you're not on the pain side ankle. So your entire body is going to be compensating and trying to, number one, minimize your pain and minimize further damage, but also it's going to help you try to continue to function. So even though it doesn't feel like your pain is less, your body's actually protecting itself and helping you function with as minimal pain as possible. But what that does, it causes an imbalance in your body, right side versus left side. So I don't just look at someone's low back and leg as far as their pain goes. As a matter of fact, what we learned in school was, hey, you know what? If you have a tight muscle as a result of sciatica, if your butt muscles are tight, your glutes are tight, your ham's tight, the way to loosen that tight muscle is to take it, stretch it, and make it tighter to try to get it to relax. But it's tight for a reason. And if you think that pulling something tight that is tight and protecting for a reason, pulling it tighter is not going to make it loose. It's just going to make it fight more. So what I do is I look for where these imbalances are, and I have people move into the positions that are comfortable and easy. So for instance, the first exercise that I typically work with everybody, and it's kind of amazing because when I was in school, what you learn is if somebody has a disc problem, you never rotate their spine because you don't know what's going to happen. My first thing that I do now, I rotate their spine because I think, hey, you know what? If you're going to go out, if you're going to try to walk, what's happening every time you take a step? Your spine has to rotate. And if you don't have that rotation, you're not going to be able to walk very well. You're going to be walking like a stiff tin man without any movement. So I always tell people, all right, let's rotate one direction, then rotate the other. Inevitably, one of those movements is going to be tight and restricted and painful. The other one's going to feel much more comfortable. So what I have my clients do is I work them into the comfortable position repeatedly because when you move into a position of comfort and ease, your body tends to relax. Your central nervous system isn't as guarded and your brain gets the messages, hey, this is safe, this is okay. And things start to relax. And then after we're done, just to see if we made any progress, we go back to the side that was not as comfortable and we test it. And 95 times out of 100, the side that was not as comfortable, all of a sudden now is a little bit more balanced to the easy side. So you're able to either move further, your pain is less, it feels less stiff so that you're improving the imbalance and getting your body more balanced. Because what I have found is when you balance out those imbalances in your body, your symptoms tend to calm down pretty quickly because your body's not fighting against itself with all these imbalances, with the extra physical stress and muscular stress throughout your body.
Yeah. So do you work with people doing like video consultations to talk them through these kinds of exercises, or how does
Yeah,
that work?
what we do, I have a couple advisors who would talk to people first to make sure that we're a good fit. And then I have several programs that we do, group coaching program. During the week, I have an online course that people are going through on their own. And then they would meet once a week, whether they decide that they want group coaching or one-on-one coaching. And depending on what they choose, they're going to be either meeting in a group setting with up to 5 people for an hour, or they'll be meeting one-on-one with a coach for 30 minutes. And so what we do during those coaching periods is make sure what they're doing is correct. If they have any questions, any problems, any issues with any of the exercises or things that they're doing during the day, we can personalize things more for them. But what's amazing is I created this course back in 20, I believe, and I have yet to have 2 people go through this course identically. And I've had about 2,200 people go through this course. But what we're doing is we're teaching them how to find their imbalances. So We might be moving their arms, we might be moving their trunk, their legs, all different movements and positions so that they can find their imbalances and treat themselves.
So, what do you do if someone does have a focal abnormality that needs to be fixed? Do you work with their physical therapists or doctors back home, or what do you do about those?
What I have found with those focal problems are, and I'm assuming you're talking like a herniated disc that's pinching on a nerve.
Yeah.
What I have found is when you balance the body out, and I'm just going to grab my little, when you balance your body out, what happens if you have a bulging or a herniated disc that's pinching on a nerve? What happens is the muscles around that area tighten down to protect it. And when you balance out the imbalances in the body, guess what happens? Those muscles don't have to protect as much because they're not fighting against the imbalances. It loosens up and your nerve actually becomes more free. And a lot of times, disc herniations generally heal on their own over time. It might be quite painful for a while, but once you start to learn those movements, positions, and activities that you can get into and adjust yourself to so that that nerve is not being as pinched by that herniation, it will heal. The body will relax. There will be less tension in that area, so the inflammation will definitely calm down and you can function. I've had so many people who have come to me that have been told there's no way you're going to ever walk or drive a car again unless you get this taken care of. And within 3 to 5 weeks, they're walking, driving their car again with very minimal problems. So even some of the surgeons that I've talked to, I have a couple friends who have gotten out of doing back surgeries because of the high failed back surgery rates. And then they started working a lot on different breathing techniques, CBT, the cognitive behavioral therapy,
Mm-hmm.
trying to retrain their brain away from pain. And actually, I just became a certified instructor through Stanford University, a program called Empowered Relief, which they've studied that against the CBT training. And the Empowered Relief, actually, you get 6 months of relief after a 2-hour webinar that you start practicing and doing at home. So you're basically retraining your brain away from pain. And to me, it's been amazing. I've had some people who have just thrived on that. When I couldn't help them mechanically with different movements, once we start getting them to realize, okay, hey, you know what? Yes, I've had this pain, but I know it goes away in time and I'm going to be okay. Their body actually starts to relax. And once you get the body to relax and your brain to relax about the tension that's going on, it actually eases the central nervous system tension, which actually decreases the pain.
Have you worked a lot with athletes, helping to get people back into athletic shape and performance?
I've had several marathoners and half marathoners who I've worked with who were told that they would never be able to do those again by their chiropractors and their surgeons. And I said, all right, if that's what they say, I don't care. Let's see what we can do to get you back. And several runners have gotten back to doing, I've had a professional rower from Australia who had piriformis syndrome and they couldn't help her. I had a lady from Belgium. She wasn't an athlete, but she was 10 years she was suffering. 5 years she was couchbound and was told there's nothing more that their doctors can do and that she would never hold down a full-time job again. And after 8 weeks of working with us, she got a job and started building up to full-time. She was able to go dancing at weddings. She said, I'm living as if nothing ever happened. So
Amazing.
it's treatment approach. It literally blows my mind every time I see it, even though I've been watching this for 16 years, that it goes totally against what the normal PTs do. And I've tried to tell so many of my PT friends, hey, you know what? Take some of these courses and learn this. And they're like, we're doing fine. We don't need it.
Right.
It helps me if they don't do it, but I'm trying to get more people to recognize, you know what? Traditional PT often is not all that it's cracked up to be. And if you can add this to your tool chest and get people better faster and teach them how to take care of themselves and balance out their bodies, you're going to make a lot more fans and have a lot more friends who get better quicker.
Yeah, I think that as providers, we're always learning, and it is hard not to have a closed viewpoint to things you didn't learn in med school or PT school or maybe not mainstream. I mean, so much of what I deal with in the aesthetic space is not mainstream. And it doesn't mean that there's no science behind it. It's just different and it's newer. And so you have to be able to look at all things and evaluate them from, a physiologic point of view and then also from a practical point of view, right? Does this work? Curious to know, can you help people? Because I think a lot of people who are active run into back pain problems. This was me, right? So I work out all the time can you help people hone in or change their exercise routines so that they are doing more of these positive release movement and potentially staying away from things that are triggering the pain in the first place?
Absolutely. Yeah, that's what all my programs focus on. And for anybody, if you've got back pain or if you got sciatica, anything that you're doing that triggers your pain, or if you notice pain while you're doing it, just stop right away. Because I
Yeah.
always tell people, and I never learned this in school, but if you just think of your sciatica as a wound, and yes, it's not an open wound like you would have on your arm, but if you would treat it like a wound, you're not going to dig on, stretch on, and exercise that wound until it heals up. In the same way, if you've got sciatica, whether it's caused by your piriformis muscle or a disc bulge or disc herniation or stenosis, no matter the cause, if you keep doing things that aggravate it, it's like picking at a scab on your arm and wondering why it's not healing. So anything that you're doing that's causing pain or causes a pain an hour afterwards, try doing that movement or activity a little bit differently so it doesn't flare you up. Because the more you trigger your symptoms, the more your body's going to compensate. The more your body compensates, the more things get out of balance, which adds more tension and stress through your body, which delays the healing that you ultimately want.
Yeah, I think years ago, the first time I had back pain, I don't even remember. I think I was around 40. I figured it out. It was these like one-legged Romanian deadlifts that I was doing that was killing me. And once I figured that out, myself out of the back pain problem. So, what about diet? Do you comment at all on people's diet, or is that just not something that you focus on?
I do. It's not my main focus, but obviously there are things that inflame people and things that de-inflame that you eat. So obviously, any type of sciatica issue is an inflammatory issue that's going on because it's going to cause chemical irritation that's going to cause your sciatic to be worse. So I'm always telling people, look, if you eat a lot of gluten, if you eat a lot of bread and you notice within a day or two things flare up, maybe calm that down. I always tell people, and a little sarcastically, but if the food really tastes good, it's probably not the best for you. And that's because I'm a sweet tooth and I like a lot of junk food. But there are good tasting foods that are healthy for you. So yes,
Right.
food does play a part of
Right.
it.
And
You know
I
what?
would, yeah,
But
I would add to that. So this is a really big topic, and I've gone into this quite a bit in my practice. But yes, a lot of foods that are in the mainstream American diet are extremely inflammatory. And so if you do have chronic inflammation of any kind, whether it's cardiac disease, whether it's an autoimmune disease, whether it's even just getting the common cold, those symptoms will be fed by inflammatory foods. And if you eat then it will help to calm those things down because it's like taking the oxygen away from the flame. And it's really hard for people to deal with this because if you're your basic, I like sandwiches and pizza and pasta, then it's really hard to go switch to an anti-inflammatory diet because a lot of gluten and sugar and all the stuff basically in the middle of the grocery store. So if you really want to go anti-inflammatory, you kind of need to eat your basic protein and vegetables and fruits.
yes,
And that's a lesson that most people kind of don't want to hear. So maybe we won't
no,
stress it too much. I was hoping to ask you about your book. So Dean also has a book that you can buy on Amazon. It's called Sciatica Relief Now. I help my wife overcome excruciating sciatica. Now it's your turn.
yes, I
Um,
have it right here.
right.
Yes. So it was March of 2018 when I started my Facebook group that I talked about earlier. And literally in May of 2018, my wife woke up one morning. She goes, Dean, it's hurting from my butt to my heel. Being the sensitive, loving, amazing man that I am, I started laughing, thinking she'd been hearing me talk to all these people. And so she was just maybe missing out on some attention. And I thought, I was laughing. And then she stood up and started shuffling like an old woman. I said, you're not kidding? She goes, no, why would I kid about this? And I said, when have you ever had a back issue that have you ever had? She goes, I've never had a back issue my entire life. And it was like out of the blue. And so I said, let me help you. She said, don't touch me. Don't help me. Don't do anything. I need to get through this. And I thought, okay. I realized I had never seen anybody that fresh of a client have it. I mean, the moment it started, I happened to be there. Mid-afternoon came. She goes, all right, help me. I can't handle this anymore. She was literally just shuffling around, moaning and groaning all day with about a 9 out of 10 pain. And I said, all right, here's what we're going to do. So I put her in 2 or 3 different positions that felt semi-comfortable to her. And I said, all right, this is all we're going to do for right now. You're going to move from position 1 When symptoms start, you move to position 2. When symptoms start, you move to position 3. And it was like every 2 seconds, she would be shifting from a seated position. I forgot, it was a sort of standing side bend, and then seated, a different movement. It was 3 different movements. And after about 2-3 minutes of doing that, the time started increasing because she was getting into comfortable positions again and again, stopping when the pain started. And after about a half hour, she was feeling about 60% better. And I typically don't do that first with patients. I typically want to get them an exercise, but she literally couldn't move. So I just had her, and within 2 weeks, she was back to walking. She used to walk like 8 to 10 miles a day around Charleston, South Carolina when we lived there. So within 2 weeks, I said, look, it's not healed. I don't want you walking 8 to 10 miles. Start with a mile or 2. And if that goes okay, we'll slowly build up. And within about 4 weeks, she was walking around doing everything normally, didn't have a problem again. And I realized, wow, this works a lot better than I actually thought, especially because obviously if my wife can get better, anybody can get better. That's when I wrote the book. And then when it was time to move out of our house that we hadn't sold yet in Charlotte, and we were packing boxes, and I said, look, do me a favor, don't be bending and lifting a lot, because this was like 4 or 5 months after. And I just said, I don't want you flaring up what you had. And sure enough, she's in the kitchen. I'm in the living room. And what do I hear? Oh, no. And I ran in. She was leaning over, putting pots and pans in a box. And I said, I told you to leave the heavy stuff. And this was a minor bout, but we went back to doing the exercises. And what she realized was she would do the exercise to get her body balanced, but she never progressed into the stability exercises. So I said, all right, this time we're going to get to the stability exercises. But again, it happened so fast that she overcame it that she decided, I don't need anything. I feel great. And she was back to walking. And then she was clipping her toenails one day, bent over. And I hear it again. I go, Trudy, no. She goes, no, this one's a lot higher than the other one was. And I go, yeah, but once your body starts compensating, it's going to stress that area. So here's what we're going to do. We started doing the balancing exercises. The symptoms came back a little bit. And I said, this time I'm going to give you my program again, and you are going to go through the entire thing. So once she went through the stability exercise, and she goes, Dean, you have to tell people my story because I did great. I got balanced. I was able to function, then I would relapse. But since she started the stability exercises, she hasn't gotten the sciatica symptoms again. She developed a drop foot about 8 months ago, just out of the blue, woke up and said, my foot's dead. And so we started working it again, and she's almost back to normal now. But the sciatica symptoms, once she's stabilized in the way that I teach in my courses, she hasn't had any back or sciatica issues since.
That's so interesting. Yeah, I thought it was really, just terrible, but also crazy timing that literally last night when we were going to bed, my partner all of a sudden had this excruciating shooting pain. And I'm like, well, I'm interviewing an expert in this tomorrow, so I'll get some information for you. So where
There you
can
go.
people find your program online?
They can't find the program online. We try to make sure that people are a good fit so that they're not just jumping in without us talking to them first. So if you look at the book, I try to keep everything pretty simple. Sciatica Relief Now. info@sciaticreliefnow.net, or my website online is sciaticareliefnow.net.
Okay. And we'll have those links in the show notes so people can find you. Is there anything that we haven't talked about that you'd like to leave our listeners with?
What I would like to leave your listeners with is, if what you're doing is not working and you're not working with someone who considers himself a specialist in sciatica, please don't waste any more time. Find somebody in your local area or reach out to us. We'd love to be able to help as many people as we can. But if you have a sciatica specialist in your area, it's probably much more convenient. Maybe not, because you don't have to travel to see me. We could just click a button, or you can just get online and go through a program on your own. But I have seen so many people. I have dealt with people who deal with sciatica from 6 months up to 63 years. And they keep doing the same thing over and over again, thinking that, all right, one of these days it's going to go away. But I tell my clients, or tell people who talk to me, if you're not seeing changes in 3 to 5 visits to your specialist, and a difference meaning, okay, the symptoms are delayed in onset, maybe they're not as intense, maybe you can do things now that you couldn't do before, that's all positive. But if you are like most of my clients, that chiropractic, physical therapy made it worse, medications maybe worked to dull the pain, but the problem is when you dull the pain, you start doing things that you shouldn't be doing, and you're aggravating the problem, which means you need to take higher doses or change your medication to get the same relief. If things are not changing to your liking, please, please, please either reach out or find somebody who will treat you differently than what you're getting done now.
Yeah, well, I think that's great advice. And I really appreciate your being on the podcast today. It's been really interesting and educational for me. Thanks so much for being here.
Well, thank you, Dr. D. I loved it. And anytime you want to chat again, and if your partner needs some help, you know how to get in touch with me.
Absolutely. We'll be reaching out. All right. Thanks so much.
All right. Thank you.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website MedSpaMayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.